All right, let's talk about something that's on a lot of people's minds, managing diabetes during pregnancy. It can feel like a huge challenge, but today we're going to lay out a clear roadmap. We'll look at the latest research to really figure out how to aim for the healthiest possible outcome for everyone involved.
And look, this is not some rare thing we're talking about. In the US, the numbers for all types of diabetes in pregnancy, we're talking type 1, type 2, and gestational, they're all going up and pretty dramatically. So having a solid plan has never been more important.
So let's just start by framing the challenge here. What are we really up against? What are the stakes?
Okay, so if blood sugar isn't kept in check, the risks, well, they're pretty serious. For the mom, there's a risk of preeclampsia, which is a really dangerous high blood pressure condition. For the baby, we're looking at things like being born much larger than average, having low blood sugar right after birth, or even breathing problems. And these things can have a ripple effect, increasing their own risk for things like obesity and type 2 diabetes down the road. But, and this is the most important part, these risks are absolutely not a foregone conclusion. They can be managed and managed well with the right game plan.
So I know that sounds like a lot, but those risks are why we're here. They can be managed. So what's the game plan? How do we actually do this?
The best place to start is actually before pregnancy. That preconception care, it's everything. It's the foundation for the whole journey. And the American Diabetes Association has a really great checklist for this. It's all about getting ahead of the game. Step 1 is basically don't stop your birth control until you've got a solid plan in place with your doctors. The main goal is to get our blood glucose levels as close to normal as you safely can. And if you've had gestational diabetes before, you'll want to get screened again before trying to conceive. And maybe the most important part, you're not doing this alone. It's about building your team, getting specialists like a maternal fetal medicine doctor and an endocrinologist on board.
So what's the magic number we're aiming for before pregnancy? Well, the ideal A1C goal is less than 6.5%. Now, your A1C, that's just a snapshot of your average blood sugar over the last few months. And the reason that 6.5% number is so important is because the research is crystal clear. Getting below that level is linked to the absolute lowest risk of congenital anomalies, or birth defects. And this is critical because those can happen super early, sometimes before you even realize you're pregnant.
And it's not just about blood sugar. This planning phase is a whole body check-in. You've got to review all your meds. Some, like certain blood pressure pills or statins, need to be stopped. You want to start a prenatal vitamin with enough folic acid. And super important, get a good comprehensive eye exam to check for any diabetes-related damage or retinopathy. Plus, you'll screen for other things that often go along with diabetes, like thyroid issues or high blood pressure.
Okay, so you've done all that prep work. Now, once you're pregnant, the game changes a bit. The focus really zooms in on managing those numbers every single day. So what are the new targets we're looking at? All right, here are the numbers from the American Diabetes Association. When you first wake up, that fasting number, the goal is to be under 95. Then, after you eat, you're aiming for under 140 1 hour later, or under 120 if you check at the 2-hour mark. These are going to be your day in, day out goals to talk about and work on with your team. Now, especially for folks with type 1 diabetes, technology is a total game changer here. I'm talking about continuous glucose monitors, or CGMs. These things are incredibly powerful. We have solid research showing that using a CGM leads to way better outcomes, like fewer babies being born too large and less of that dangerous low blood sugar for the newborn right after birth. And this is the really cool part about how CGMs work. It's not just about checking your blood sugar a few times a day. It's about this concept called time in range. Think of it like this. The goal is to spend more than 70% of your day in that sweet spot, which for pregnancy is between 63 and 140. You also want to spend as little time as possible, less than 25% above that range, and really, really avoid going too low, aiming for less than 4% of your time below 63. But it's not all about tech and medications. Of course not. Lifestyle, and especially what you eat, that plays an absolutely massive role in all of this. So that begs the question, right? Can a specific diet really move the needle for women who are already at high risk? Well, there was a big study, the ESTEEM trial, that decided to find out. So here's what they did. They took one group and put them on a Mediterranean-style diet. You know the drill, lots of nuts, olive oil, fruits, veggies, low on red meat and sugary stuff. They even gave them free nuts and extra virgin olive oil to make it super easy to stick with. The other group, the control group, they just got the usual dietary advice you'd normally get during pregnancy. And the results were fascinating.
When they looked at a big bucket of overall complications, there wasn't a huge difference. But when they drilled down on one specific thing, gestational diabetes, the result was incredible. The women on the Mediterranean-style diet had a 35% lower risk of developing it. That is a huge reduction. And that wasn't all. There was another pretty cool bonus. The women eating the Mediterranean diet also gained less weight during pregnancy, about 1.2 kilograms, or almost 3 pounds less on average than the other group. Okay, so we've covered a lot of ground. Let's boil it all down. What are the key things you really need to remember from all this? Here's your roadmap, plain and simple. Number 1, plan ahead. Seriously, preconception counseling is your superpower. It's the most powerful first step you can take. Number 2, know your numbers. Work with your team to hit those A1C and daily glucose goals. Number 3, if you have type 1, use the tech. CGMs are proven to help. And number 4, don't forget your lifestyle. A Mediterranean-style diet could slash your risk of gestational diabetes. It really can make a huge difference. And that brings us to one last really interesting thought. We just saw how powerful a specific diet can be during pregnancy. So it just makes you wonder, what could that same diet do if you started it before you even conceived, as part of that all-important planning phase? I mean, if it's that protective during, imagine the potential of starting it early. It's a pretty powerful idea to think about. Thanks for joining me.